Last podcast of the year, 2025. Let's talk about 2026 on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right by my side. Thank you so much for joining us. If you are a first-time listener, we welcome you and we welcome you to our last episode of 2025. However, we have hundreds of episodes in our library since we've been podcasting for over 10 years. And so please check out any of those episodes. All of that information is still pertinent and great information. And if you're one of our regular listeners, we love you and we love that you continue to be on this journey with us. So we are so excited.
I can't believe 2026 is here.
It's crazy.
I know.
It's crazy. The year goes by fast. When your kids start noticing it, then you know it's going by fast. Yeah. So a lot happened in 2025. I say we should recap it.
A lot of big things.
Yeah, let's recap a little bit.
Yeah.
So in 2025, we closed our practice that we'd had for almost 19 years. And we just, it was a huge, very hard decision that we had to make. And there were many factors that played into it. And ultimately, we decided that it was time. Our lease was up. There are a lot of things that had happened in the practice, and it had a great. It
had a great run.
It had a great run. It served multiple purposes. We were able to provide jobs for a lot of people, including our mothers, which was a blessing. And but it was time.
Provided care for tens of thousands of people.
Yes.
I think when we closed, we had like a 36,000 patient.
We did.
panel.
Yeah. We have about 36,000. So it was such a blessing to have been able to have that practice. And it was great. We loved it. And we made a lot of wonderful friends. And so anyways, we closed up in April and then we took a little month off. We took May off and went did a little traveling to Hawaii. That was a lot of fun, just Tina and I. And then in June, I started a new job. I started working at Dignity downtown, and also I still go to the surgical center in Avondale, Surgical Elite, and did slow down a little bit. I'm doing procedures, scoping 3 days a week. And so that's been nice. I have to say that it has been a huge transition for me though, because I'm so used to like go, and it's been really hard for me to learn how to relax. Slow. Yeah, how to relax a little bit, and also how to manage my time. And it's something that I'm not great at. It's funny because my wife realized when I started this new job, and the transition was that she would then be working from home and be working our wellness business full time, and then that I would help part time. And one of the many reasons we closed was so that I could slow down a little bit and then be able to work more in our wellness business, because I've been wanting to do that for so long, but I couldn't. And, but anyways, so fast forward into June of this year, I start my new job, and then my wife and I start, making plans. And when we were in Hawaii, we did a lot of strategizing on how we were going to grow the wellness business. But I realized that, and she actually the one that said, I realized that maybe part of the reason you struggle with your time management is because every day you have a schedule of procedures, and you know that you're going to start at this time and you're going to be there, and you know what you're doing. You're doing your procedures. You're taking care of these patients, doing your procedures. And it's not like you have to put that into your calendar, which is true. Yeah. I don't have to put that in my calendar because I know
the work goes to you.
The work is there, and I show up and I get to take care of all these patients, and I love doing the procedures and taking care of these patients, and then I go home. and I go home and,
And then when you have a patient who needs you, they call and
Yes.
you get an encounter.
I
that
get
you
an
have to call.
encounter that I call.
And then when the
Exactly.
pathology is ready, you get a notice.
The pathology comes in and I review
You have
it.
to review it.
It's not like I have to make a task like review
Exactly.
pathology. The pathology is going to be there, and I
Exactly.
just know it has to be reviewed. So it's not like I have to make a to-do for myself on that. That is just automatic in the life of a gastroenterologist.
That's right. Well, the work just comes to you.
Exactly.
Right? Yeah. So
and you do it.
That's what I realized this year is that, you know, when you have a business like the wellness business and we're trying to grow it, the work isn't just coming to you. You have to go get the work. And we created these strategies to go get all this work. And you would start getting the work, but then you would stop because you would make the phone call, but then wouldn't follow up or whatever, because you're not used to that. You're not used to that.
It's a totally different mindset.
I remember asking you, I was like, well, where's your to-do list? And you're like, what to-do list? I was like, what? Like, and I even told one of my good friends, I was like, can you believe she doesn't have a to-do list? And she's also like me, like, she's like, you know, super like business person, like has to go get the work. And she's like, I can't believe she's never made a to-do list. And I was like, I know, like, well, it was crazy.
So look, I do have my own to-do list.
They're like little personal
They're like things. And they're my to-do list that I put on my little stickies. And also I love little index cards. Yes. And I do those
all over
and
the
I
house.
put a little square and yeah, so those, and actually that does take me back to when I was in grade school, because I always had a little notebook that was for my assignments. And I always write down my assignments for that class in a little square, you know, so that was my to do. But it's true. It has been a shift in mindset. And I'm not going to lie, I'm not doing great at it. Okay. I'm not doing great at it because I do great at being a gastroenterologist. I do great at showing up for my procedures and reviewing pathology and making medical decisions. I do great at that, you know, but
I love though that the one thing that you have been doing that's new is you've been selling supplements out of your backpack.
Yes.
That's been awesome. Like, takes the supplements along with her to the surgery center, and for the patients or for even the staff. Like they're like, what is that? And she tells them, I want that. So that's been really cool. You've been like a backpack.
A sales girl.
Salesman.
Yeah. I've been like a backpack sales girl. And I told Tina that I needed one of those suitcases that it opens up and you could display your products there. So, but
luckily we only have a handful of products, so they're easy to carry around.
Yeah. So I've been selling out of my backpack, and actually it's pretty cool. Yeah. It's pretty cool. So it is a shift. I mean, look, I'm a physician. I've been practicing for, you know, over 30 years. Mm-hmm. And so I have my habits as a physician, you know, taking care of the patients and doing all that. But now, because I'm working in the business with my wife, she has been working very hard to try to teach me some new habits. And it's taken a while, but I have listened to a couple great audiobooks on selling like crazy and changing your mindset. And that actually has been really great. Yeah. It's been very, very eye-opening for me.
I mean, the reality is, this is the conversation you and I had, that people are out there buying stuff anyway to try to get better, right? I mean, they're at the Walgreens or the CVS down the digestive health aisle. They're, you know, I mean, we're spending $260 billion a year trying to help our digestive system. Okay. So I told you, like, one of the things we talked about was that you just have to educate people on what they should be spending their money on to help them get better. Right? The money's being spent anyway. It's just do them the favor and teach them so that they can buy the right stuff.
Yeah, absolutely. And so it's, you know, it has been a lot of growth, a lot of growing. And, you know, and then Tina and I, as you know, we do a lot of self-care. We've put out a lot of videos about things that we do. We do hyperbaric oxygen treatments. We do red light treatment. We do a lot of that kind of stuff. And so for me, also trying to manage my time on when I'm going to do stuff, because for me, having a day off from doing procedures is like, I get to rest my hands and not be standing, because I'm standing all day long. So it's such a nice break. that sometimes I think I'm on a little vacation on my days off. And
Mm-hmm.
so I'm like, oh, well, I'm going to go do some self-treatment. Oh, I need to catch up on, my emails or whatever. So trying to balance all that, hey, listen, I just started as a new business person in this business now in the summertime. So I'm like, honey, please be patient with me.
Yeah.
But little by little, I think that now in the new year, I mean, we'll talk about that, but I wanted to let Tina talk a little bit about her role as she transitioned out of being in the office because it was a significant transition for her. So
yeah. No, I mean, you have the business that's on you, the staff, that relies on you. And now I'm alone working from home. I don't have really anyone relying on me anymore because even my children this last year got cars.
Yes.
And so now that they're driving, we didn't think we were going to have empty nest for another year and a half, but we have empty nest right now.
Yeah, we
because
do.
They are never home. I'm making these beautiful meals for dinner, just like I always do. And then we sit down and it's just the two of us,
Yep.
which is fine. I mean, I love staring into your beautiful face, but the kids aren't there to eat. We're making plates for them. We're keeping them there. And that's kind of been our year this year as they start their new jobs and they have cars and they're busy with school and theater and friends and all kinds of things. So that's been a huge transition for me, not having anyone rely on me anymore, which has been nice. It's like a pro and con, right? Like I like it because it gives me time then to focus on me. And it also gives me time to focus on the wellness business because that was, again, one of the reasons we closed the practice was we've never really been able to put our full effort into the wellness business. And it has grown over the years, but not as much as we've wanted it to. So it has been good to put our full effort, my full effort into the wellness business. It's been good to see what's working, what's not working with growing the business. And I'm just looking forward to next year to really, now that I think we spent this year kind of figuring out what's working and what's not working.
Yes.
So that we can really hone in on what's working. Yes. And so I'm excited for that. And just, some exciting things coming in 2026 for the business. We've created a relationship or signed a relationship with the Peoria Lifestyle magazine. And you have an article coming out in the January issue of that. So if you live in Peoria and you get that magazine, be looking out for the article on Dr. Cruz. But we're going to be doing some marketing with them for the next 6 months. We're going to be doing some new videos where we are really going after the over-the-counter digestive medicine. So I'm super excited about those videos.
Yeah. A lot of new things. I mean, hopefully we'll be talking a little more.
Yeah. We're going to be going out and doing talks, local events in the cities. So we kind of spent these last several months kind of laying the groundwork for all of that happening in the new year. We also are going to be targeting weight loss clinics with our GLP-1 Power Pack. So I'm really excited about that. Going to wellness fair. We really started just kind of here toward the end of the year, kicking off the digestive health home parties. And we actually recorded one in Spanish that I'm really excited to get that out there to the world so that we can start educating more through YouTube. And then just from a personal standpoint, and most of you know that are watching us regularly, that I'm working on my 5th degree black belt.
Yes.
So I've been recording a lot of videos, all my weapons, all my forms, and that's coming up here in early 2026.
Yeah.
So I'm excited for that to come and be over because there's a lot of work that goes into that.
Yeah, she's been working very hard on that. And so I'm very proud of her. She's amazing. There is a certain amount of fear I have also. So, have to watch out for my 5th degree black belt wife.
I could kill you with these hands. Yes.
Have to open up a can of Puerto Rican spice on her. And
exactly.
So anyways, a lot of exciting things. There's been a lot of learning over the past several months. I will say that even though we were very sad to have to close the practice, that in the end, it's turned out to actually be a blessing because, it had become harder to be able to, to kind of make it in the medical field as a solo practitioner. Well, we had a couple nurse practitioners, but as a small practice, it's just become harder. And so, God knows what he's doing. And even though there was some kicking and screaming going on my side with not wanting to close the practice. In the end, it has turned out to be really great. And I love my new job. And
you needed to slow down.
Yeah, I need to slow down. And I love that Tina and I could work a little closer together. You know, a lot of people ask me, they're like, what, you and your wife work together? How do you guys do it? And then you're at home together. I got to tell you that I love working with Tina. We recently did a free clinic where we worked together, and I was playing the doctor. Well, I mean, not playing the doctor, but I was the doctor, and she was a nutritionist, and they put us together seeing these patients, and it was so much fun. It was wonderful. We took care of these people that were coming to us, and I told her, I really love working side by side you. Yeah. And and so we enjoy working with each other. The reality is that during the years of practice, I was usually at the surgical center while she was at the office. So we hardly saw each other, but nonetheless, I enjoy working by my wife's side. And then I really don't see her that much in the evenings because she's gone to Kung Fu. And by the way, that's actually been another area of growth for me, because since our children are now, gone most of the time, and even if they're at home, they don't want to be around us. They're in their rooms. I've had a lot of time on my own. And at first I found I was like looking around like, what do I do? I mean, one day I came home, I was like, hello. I was like, it was like Home Alone. I was all alone. And so it's actually given me time to do things that I enjoy doing that I haven't done for myself in a long time, because we've been so busy in the practice and raising kids. And so, I pulled out the ukulele, pulled out the guitar and dusted them off, and my congas and
I come home after Kung Fu and she's just wailing away on the congas. Yeah. I just love it. Yeah.
I love instruments and playing music. Grew up in that, and so it's in my soul. It fills my soul. Doing more reading and just collecting more books, which I love. Going thrifting with my daughter.
Of books everywhere.
That's right. So anyways, a lot of wonderful things have happened, and we're really excited for 2026. And we're really excited that you are always here with us to support us. And if you're a first-time listener, we welcome you, and please stick with us. If you haven't subscribe to our podcast so you never miss an episode. And if you haven't rated us, please rate us and please give us a 5. It'll help other people just like you to find us faster. You can connect with us. Go to our website, drlizcruz.com. You can click on the magenta color button that's on the homepage and schedule a free 30-minute wellness consult. It's free, and you could do it from anywhere. It's done on the phone. We'd love to hear from you. Thank you so much. Have a wonderful holiday, and here is your New Year kiss from us. Mwah! We'll catch you on the next podcast. Thank you so much for joining us.
2026.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.